Hi, it's Debbie Seidel-Dickey, and welcome back to the Practice Solutions special training I've created for the month of May on the 4 Ds for getting through that 60-minute prophylaxis patient appointment. We've talked so far about data collection, determining the treatment, and now we're going to talk today about that time we're going to do treatment on your patient. It will be approximately 25 to 30 minutes. So follow me now while I walk you through this. I have broken these time management areas of the hygiene appointment into these 4 phases, and today is phase 3, do treatment, and especially want to emphasize the prophylaxis appointment, which I know is that one procedure that can keep us hygienists from running on time. If we look at these areas and learn to properly manage our time, it will help us to work smarter and not feel stressed throughout our day. So today I'll provide a few tips for you to stay on time during the hygiene appointment. The prophylaxis appointment is for a healthy dentition. It is not for a patient with heavy supra. And many of your patients, even with moderate supra, when you get below the gingiva, there's more than just moderate supra there. Subgingival calculus is there, and it's probably even heavier than what you see supragingivally. Patients who have bleeding upon probing, I want you to take into account these are most likely patients who are more than just a prophylaxis. Are you planning to scale more than 2 or 3 millimeters below the gingiva? And do you estimate that you're going to be scaling longer than 20 minutes? Because any of these answers, if they were yes, this is more than just a prophylaxis patient. Are you using ultrasonics? This is a great tool that will really help you save time and work efficiently. Generally speaking, these types of patients that I've mentioned are outside of your normal prophylaxis patient appointment. I want you to look at an ebook that I recently wrote because there are some nebulous areas of what we are considering a prophylaxis appointment. And I want you to understand that there is an appropriate treatment sequence. And if worded correctly and billed correctly, not only will your patients say yes, but your office will receive payment for these additional visits that require less than scaling and root planing and more than just a prophylaxis with even 4 or 6 months return for routine preventive care. So you can download this information in the ebook at the bit.ly/plaque-induced gingivitis, and there you can read the sequence flow of treatment and billing and when you can start restorative dentistry if that's necessary for patients with more than just a prophy. One of the areas in the do treatment phase that can help you stay on time is your doctor hygiene exam. That doctor will enter to do that exam anywhere between 30, no later than 45 minutes into that hygiene appointment if you have a 60-minute hygiene appointment. For those of you who have less than 60 minutes, you're going to create your own down-to-a-science strategy for time management. The doctor enters, and it's the dental assistant that leads the doctor. They gently interrupt doctor at the appropriate time. For example, maybe when doctor's patient has an impression that we're waiting for. And the doctor leaves to complete the exam in the hygiene room while that assistant is with the patient during the impressions. The hygienist gets up out of his chair. If doctor's right-handed and the hygienist is right-handed, the hygienist is going to get up and move to the other side of the patient. Notice in this picture here, we've got kind of, you can see it's a triangle, not a completely straight triangle, but the hygienist on one side and doctor on the other. And so it is another area that builds rapport. It's called proxemics, like I spoke last week in the treatment planning phase. And so the doctor will enter, and if this is a patient of record, there's no need for that patient to be seated upright for a formal introduction. The hygienist can just make some, real small chit chat with doctor about the patient. For example, Dr. Goodtooth, Mrs. Smith's daughter just graduated from Harvard Medical School, and now they're going to Hawaii to celebrate. And doctor can say something, a nice remark in response to that, just some small chit chat, maybe 60-90 seconds of that, and now the hygienist will lead doctor through the data collection, what was discovered during the data collection and what was discussed throughout the treatment planning phase. Does that patient need to schedule for the restorative treatment that's outstanding? Do we see that today they have some periodontal pockets and they need to come back for maybe another prophylaxis appointment? Today's going to be a gross debridement. Or maybe you've talked to that patient about scaling and root planing. And doctor's role is to agree with the hygienist, because after all, my hope is that doctor and hygienist have calibrated what they believe is periodontal disease and what they believe is a prophylaxis. You know what you call as a 4mm pocket, and doctor calls a 4mm pocket. How much time are you scaling? And how much time do you spend chit-chatting about personal topics with your patients? I want to challenge you to think about this and attempt, if you are spending a lot of time chit-chatting, be more professional and very thorough with your patients. Another challenge is to time yourself this next week. See how long you're taking for these various areas throughout your dental hygiene appointment, even including your chit-chat. Let me walk you through some time management tips. And some of these are going to be very helpful during the doctor hygiene exam. My secret tip number one is that the dental hygienist is not going to sit around with the patient waiting for doctor to enter and complete the exam. The doctor is going to enter, and the doctor and doctor's assistant know, everybody knows, that the doctor's going to enter about halfway into the hygiene appointment. So if you have a 60-minute hygiene appointment, at 30 minutes, no later than 45 minutes into that appointment, the assistant knows. They're looking at a watch. I've had offices where the assistants in the beginning set a timer, and that assistant nudges doctor to go into the hygiene room and complete the exam. So that eliminates the stress of sitting there waiting for doctor to end and the hygienist runs behind. Tip number two is that the hygienist is going to make a short introduction to continue rapport. The patient will stay in that supine position or a somewhat supine position. When doctor comes in, the hygienist may be in the middle of scaling or using ultrasonics and just stops what they're doing, moves around to the other side of the patient across from doctor. So it's the best case scenario that the hygienist can be present during the doctor hygiene exam. This makes for effective communication and builds rapport, and you're more likely to have patients say yes to their treatment plan when doctor comes in and the hygienist reports what happens and doctor's saying, yes, that's exactly what we need to do, etc. Tip number four is the hygienist will lead doctor through the exam process. The hygienist is going to report to doctor after that 60 to 90 second conversation, small chit chat to let doctor know some personal things about the patient. Now the hygienist is very succinct, direct, straight to the point, reporting to doctor about the data collection, what was done. Was there an oral cancer exam done? Was there a periodontal screening exam? Do we have bleeding points? Do we need scaling and root planing? Has perio returned after scaling and root planing that was completed 2 or 3 years ago? What was the treatment plan discussed? Does the patient have restorative needs that needed to be addressed and now patient's ready to move forward? And what are those next hygiene services to be completed?
For example, the patient may need a full mouth series of x-rays the next time they return for their hygiene appointment. The hygienist has a great opportunity now to say, "Doctor, I know you want to have the full series of x-rays at Janice's next appointment." And doctor says, "Yes, that's perfect. Let's do those at the next hygiene appointment." Or, whatever that is that needs to be done. Maybe you just ordered the oral ID and you have this new oral cancer screening technology, and you explained this to the patient, and now doctor's saying, "Yes, we're getting this. It's the greatest and the latest technology to diagnose oral cancer before it is a terrible problem that includes, oral surgery, and we can catch oral cancer sooner these days with this new technology." And now the patient's excited to come back and have that oral cancer screening completed with your new technology. And this exam process should only last 5, no longer than 7 minutes, because the hygienist is directing the conversation with doctor, and it's short, succinct, and to the point. If you have questions whether the patient is more than a prophy, go to this ebook. You can download it, and it's a free resource that I have for you. It will answer many of your questions. In fact, it will help you to get through those questions of, will my insurance pay for it, and what is the sequence and the order, even if that patient has restorative needs and they just need to come back for another prophylaxis in 2 or 4 weeks. Here are some of the answers. It's bit.ly/plaque-induced gingivitis.
Thanks for joining me. I sure hope you found that valuable. And next week we're going to talk about dismissing the patient, disinfecting the room, and also the patient handoff to the front desk. How that's going to happen, and I'll share with you how to do that in 5 to 10 minutes. Be sure to follow me on my YouTube channel. And also, you might want to follow me on the blog, because next week I'm going to have a special ebook putting all this information together for you. And you can use that in your office.